Have you experienced pain or stiffness either at work or when you get home? While many people experience this, that does not mean that it's normal. I mean, about 37 million people in the US, that's about 11% of our population, have diabetes. But would we consider that normal? No. Stiffness and pain either at work or when you get home is not normal. So let's talk about why you feel this way and what you can do to prevent it. Hi, my name is Stephanie, practicing dental hygienist and ergonomic specialist, and welcome to my channel. Ergonomics, to me, extends beyond our workplace and encompasses, yes, what we're doing at work, but also the overall health and well-being of our bodies. While there are some medical conditions and previous injuries that can cause pain and stiffness, I will be focusing on the stiffness and pain from things like poor posture and poor ergonomics at work. So first, stiffness. Why do we feel it? Let's talk about our bodies and what they're actually designed to do. We are meant to move. We have bones and muscles and ligaments and a million other things that are designed to help us get up, walk, run, push, pull, lift, move through space, and just stay active. When you see an athlete competing in a sporting event or just someone at the gym working out, they may be breathing hard and sweating and looking like they're gonna die, but they're actually using their body the way it's meant to be used, which is muscles contracting and relaxing, joints bending and straightening, and blood pumping through our bodies. What we aren't meant to do is sit still, or sit still with unhealthy posture. Think hunching over your laptop or your cell phone, watching Instagram or YouTube videos for hours. Muscles and soft tissue need blood to remain healthy and strong. What gives them blood? Movement. So when we aren't moving, we're depriving our body of what it needs the most, which is blood and oxygen. We have waste products and tension that builds up inside of our tissues, and if we don't have blood carrying those waste products away, it will start to cause stiffness and pain. Ever feel like the Tin Man when you get up after a 2-hour movie? It's because those waste products have just been chilling in our tissues because the blood hasn't been able to carry them away. So at work, many of us are in what's called a static or fixed position. This means any position where we're just stuck there and we don't move for an extended amount of time. While there are many things we can do during the day to both improve our posture and our overall ergonomics, I want to talk about the simple act of movement as our medicine during our day. I often recommend standing desks or some kind of adjustable platform for office workers so they can mix up standing and sitting. I also recommend that dental clinicians try to alternate standing and sitting while seeing patients. For office workers, I recommend standing about 15 to 20 minutes for every hour that they're working. For dental clinicians, I recommend standing about 40 to 50% of the time while seeing patients. This could be standing for every other patient, or depending on the length and the type of procedure, mixing up sitting and standing during that one procedure. Another tool we have is something called micro breaks. These are strategic stretch breaks during our day. My rule of thumb for these is to do one every 20 minutes and to make sure you're holding that stretch for at least 20 seconds. When we're in a static position, especially if it's an awkward position, like our head being really far forward, holding the phone in between the ear and the shoulder, doing the chicken wing, if you practice in dentistry, you know what I'm talking about. We have prolonged contractions of certain muscles. The longer a muscle is contracted, you have pressure that's building up on the inside of that muscle, and it cuts off blood flow. The longer a muscle goes without blood, it will start to hurt, get fatigued, and those muscle fibers can eventually become damaged, which will lead to an injury. Holding the stretch for at least 20 seconds reduces that pressure so that blood can flow back into the muscle, giving it the nutrients it needs and removing those waste products. Plus, they feel great. Pick some of your favorite stretches and make them a part of your day. You can head over to my Instagram and watch my micro break highlight where I have full videos on all of my favorite ones. Or you can refer to my previous videos where I demonstrate my favorite ones. I recommend doing micro breaks that focus on the neck, upper traps, shoulders, forearm muscles, hip flexors, hamstrings, and glutes, since these muscles are most overworked in dental and office workers. If you like this video, please hit subscribe and stay tuned for more videos that will help you work smarter, not harder at work.